I'm Clay Johnson. I'm the Dean of the Dell Medical School. Good morning, everyone. This has been a fabulous turnout. Thank you all for coming. And obviously, this is a very special and important event. The Department of Pediatrics is absolutely critical to the School of Medicine, this hospital in part demonstrates why. I've got to first say that I have had the pleasure or displeasure of being in this emergency room with one of my children. Just, you know, being on the other side of this and understanding that there's a resource like this in our community, where already we have fabulous care occurring across the board in so many different pediatric areas. It's really an amazing asset to the city. The city knows that. The city has already embraced that this is an icon, really, for the kind of healthcare that it would like to have across the city. And also, not just healthcare, but also sees it as a way of pushing forward the whole population health. Let's get our city healthier notion. I was just listening to NPR and listening to an interview with, what's his name, Guy, the head of agriculture here, Guy. Do you know about this guy? Who's trying to, you do. I'm learning quickly what about Texas politics and ideologies. And so he's, anyway, if you don't know, he's trying to roll back all the nutrition rules. So put fryers back in schools, add soda back into the machines, all of this stuff. All the progress that we've made. He's saying that those policies that we have over the last decade haven't done anything to childhood obesity. We're still number 5, so let's get rid of those rules. And that's exactly the side on the population health side that we have a responsibility to push forward, to make sure people really understand that these sorts of policies and much more are necessary to keep our children healthy and out of places like Dell Children's Hospital. So with that, I've got to say we are really fortunate to have Steve Abrams joining us. Steve is actually a Buckeye, at least for medical school, but has been in Texas for quite a while. And on the nutrition side, we really, just couldn't have anybody who's more prominent in nutrition. Of course, he's not dealing with sodas. He's dealing with minerals and supplementation of food for neonates, but really critical on that same spectrum. Won a lot of awards for the work that he did. But it's interesting, after we offered him the job, I became even more convinced that he was the right person for this. And by the way, I've got to tell you, this is a hard job. You all know. This is a great place with a lot of people who like it just the way it is. So thinking about how carefully to navigate the existing culture here and help everyone to improve and embrace change in a place where many people are happy with today is not an easy job. But the reassurance that I got was that after Steve was selected and making his move at Baylor, they produced a goodbye card for him. But the goodbye card was actually this beautifully produced video that many people contributed to. And it was such a heartfelt expression of their attachment to Steve from his time there. So that tells me that we got the right guy. It may take a little while for you all to develop that same level of attachment and endearment. But certainly I have felt that in the few weeks that I've had the pleasure of working with Steve. So with that, I want to introduce Steve Abrams, who's going to make some comments. Thank you.
Good morning, and thank you for all coming. A wonderful turnout. I wanted to begin by expressing my tremendous appreciation to the many people at Dell Children's Medical Center and Dell Medical School, the dean, and the many people who are here who've assisted me in this transition over the last several months, and have been so gracious and welcome me to Austin and to the Dell Medical community. I also want to introduce my children who are here today, my son Michael, my daughters Ruth and Hannah, who are sitting up here in the front. And they came to share this opening event with me, and please come up to them and introduce yourselves. And if you're pediatric specialists, tell Ruth and Hannah why you think they should be doing that for their lives. And we're all delighted to be part of the UT Austin and the Dell Medical School family. I'm grateful for the tremendous confidence that was placed in me and in the Dell Medical School, which is a product of an unprecedented partnership with the community to help shape a key partner, this institution and the pediatric community for healthcare in Central Texas. I want to take the next few minutes and give you an idea of how I believe we can work together as a medical school department, as a medical center, and as a community to serve the children of Central Texas. It's overwhelmingly clear that we have an incredible opportunity to build upon the long and honorable history of this department, of the school and the University of Texas at Austin, and to create a new kind of pediatric department, one that reflects the vital, inclusive health ecosystem envisioned by the new medical school that will help make Austin a model healthy city and improve the lives of children throughout this region. We will do this by uncompromisingly developing clinical, educational resources for children, by conducting novel research into the causes and treatments for pediatric diseases, and by reaching out throughout the community to serve as expert resources, thought leaders, and advocates for children in need. When we consider the challenges of healthcare, we know that we must not only develop new therapies for treating difficult problems, such as those many of you here take care of, include extreme prematurity, respiratory diseases, neurological diseases such as epilepsy, but also to focus on making all of our children healthier through support of things like good nutrition, exercise at home and in schools, and on-time complete vaccination for all children. If we focus only on very ill children, then we're not doing all we can to change the face of healthcare and to create a department that serves all of the children of this community and changes the way we keep children healthy. I want to give a specific example related to what's close to my heart, which is as a researcher in pediatric nutrition. We know that about 1 in every 6 children in the United States 2 to 19 years of age is obese, and that number is even higher among some of our minority communities. We also know that obesity often begins in early childhood, with about 1 in 12 children aged 2 to 5 being obese. This is incredible. We must encourage and develop programs to help children who are overweight or obese deal with the severe health problems that they have. This includes comprehensive programs in gastroenterology and endocrinology, psychology, and other disciplines represented in this room that provide an effective, easy access care that's integrated across the system and available throughout not just the Med Center area, but the entire city and the region. But we also have to focus on prevention. We know that good nutrition is the cornerstone of strong school performance, long-term health, and safe pregnancies with the outcome of full-term healthy babies. We therefore must develop and implement true evidence-based effective programs to prevent obesity and overweight beginning in childhood. To do this, we have to work together with the community to change the food and physical environment in which our children live, learn, and play. Guidelines for healthy eating need to be implemented, supported, and evidence-based guidelines for healthy nutrition supported. At the University of Texas at Austin is an amazing place, and that's one of the reasons I'm so excited to be here. We have incredible resources to help understand and deal with the healthcare problems of children, and to actually test our solutions and our ideas out in the community. For example, we have a world-class genetics department. Some of the members are here. Capable of understanding things like the genetics of obesity and developmental disorders in children, and how diet, exercise, and genetics interact to influence weight gain, growth, and development. We have exercise, nutrition, and healthy living education programs in place and underdeveloped. We also have, in partnership, for example, with the School of Public Health, public policy expertise available to develop and test practical solutions to healthcare problems. We have to integrate our ideas across the life cycle. We have to work as pediatricians with our colleagues in adult medicine to develop translational programs. And we have to work across all the racial and ethnic boundaries to prevent and treat healthcare problems such as obesity. This also means advocacy and education as well as just research. We have to advocate for important practices such as breastfeeding and mechanisms to support breastfeeding mothers. We have to support programs in place that provide good nutrition for mothers and children. And we must maintain active involvement in healthcare delivery to all sectors. By doing this, we will make Travis County, the city of Austin, and Central Texas a model for the nation. And we will effectively partner with community resources. Last week, I had the opportunity to visit the Sustainable Food Center in Austin, an incredible resource, and these are the type of groups that want to partner with us and that we will partner with. One of the things that's clear to us as pediatricians is that many adult diseases, including osteoporosis, heart disease, and cancer, have their origins in childhood. Our vision is to include all groups interested in supporting healthy lifestyle, including those at both the UT and others in the community, in a partnership focused on disease prevention. This is a multi-departmental effort, but one in which this hospital and the people here can be a center point that brings groups together to provide effective solutions. I think we also have to be very sensitive to the tremendous needs of a large population of children who are challenged by neurological, psychological, and developmental problems. We need to create opportunities to provide coordinated care for complex medical conditions such as those related to autism, eating disorders, and to meet the needs of children with all types of developmental disorders so that their care is coordinated, effectively delivered, and the quality of care delivered is monitored and effectively improved as needed. Embracing and enhancing the health care of children also means improving the technological resources we use to provide health care to children. To do this, we'll partner with key resources at the University of Texas at Austin, such as the Department of Biomedical Engineering. These partnerships will advance innovation from discovery to delivery, not just in equipment, but also in the way in which we collect and use data and the ways in which we provide medications, food, and care to children. I'd like to give you a brief example. We know that human milk saves the lives of preterm babies by preventing serious diseases of the bowel and other infections. Yet when we feed the milk to the tiny babies via pump, about a third of the fat is lost in the tubing, which slows the growth of the babies, increases the time until they can go home, and makes things much tougher for them. I worked with a group of biomedical engineers over the last couple of years to redesign feeding pumps so that they wouldn't lose the fat. With some simple changes in how feeding pumps are designed, you can cut the fat losses from 30 to 40% down to less than 10%, which will lead to faster discharges and increased growth. So those are the simple types of technological innovations that we can support, develop, and work with in order to enhance the health care of children. We're part of a new medical school, the first in decades we built from the ground up at a top-tier research university, with an innovative curriculum, novel approaches to teaching. We're committed to a department that ensures that every aspect of the education we provide is focused on creating not just physicians, but also pharmacists, nurses, dietitians, and many other professionals who are committed to working with children, who understand the healthcare needs of children, and who help us transform the care that's delivered to children. We have to educate everyone and all groups of healthcare providers about crucial issues such as the importance of on-time vaccination, early intervention programs, and violence prevention strategies. I want to speak about the shortage of primary care pediatricians and other pediatric specialties across the country. We know that this shortage exists, and we need to help create a dialogue here and with others throughout the country about the many reasons for this. We have an opportunity to think carefully about that and to really rethink the pediatric education that we provide to trainees for med students and residents and make pediatrics a field in which they want to go into and understand the importance and the value of pediatric education. This won't happen instantly, but it's part of a long-term mission that we have to train caregivers in all aspects of pediatrics. It's become well recognized that the healthcare system does not always communicate well between physicians and family members of children who need health care. We need to look at all types of innovations, including technological ones, to improve our communications throughout the lifespan with families and with communities. In this regard, I want to highlight a currently existing innovative program I had a chance to hear about recently by our physicians who work in the Community Care Health Center of East Austin, some of whom are here. They have pioneered in the city a program called Centering Parenting, where groups of babies are cohorted by birthday and seen with their parents in groups of 5 to 8, beginning at a couple months of age and continuing through 2 years of age. This follows a similar group called Centering Pregnancy, which does the same for pregnant women. These are innovative programs. They need to be supportive, and they provide true value to the community, and we will, as a department, support them. We have to expand programs that reach us out into the community, that supported this med school, and develop a person-centered, multidisciplinary care approach. Solving problems in healthcare means working together and limiting an unnecessary leader-centered approach to decision-making that can sometimes be found in medicine. I'm reminded of the phrase my children and I have heard many times since the passing last year of my wife and their mother, Rabbi Judith Abrams, Zichrona Livracha. This phrase is Baruch Dayan Emet, which means blessed is the judge of truth, and said on hearing of the death of a member of the Jewish faith. This phrase reminds us that no human judges the truth of our life, and I can assure you that neither I nor any one person is the judge of truth, of Emet, in this department. We're in this together, and we'll build the department together, learning truths from each other. As Dr. Johnson mentioned, we're well aware of your concerns about the role of a new academic entity in a well-established pediatric healthcare environment. And I assure you that our plan is to collaborate, support, and enhance, not to replace or unnecessarily try to change the outstanding health care that's been provided to children here for many years. I believe this department can and will be an inspiration to students, to physicians, and to members of the medical community and the community at large, because we will be successful in the tasks that I have discussed in serving the community. I need your support, hopefully your friendship, to help us make this vision a real one. I need your patience as we create a department from an idea and a small initial staff and faculty group. I hope to earn your confidence and promise that your ideas have value, that your input into our department is critically needed, and that your emails will get as quick a response as I can provide, which those of you who know often means that will occur at odd hours of the nighttime. Thank you again for the privilege of being this department chair, and welcome to the new Department of Pediatrics.